The outbreak of Ebola virus disease in West Africa continues to escalate as the World Health Organization puts the number of cases at 1,975, with 1,069 deaths reported from Guinea, Liberia, Sierra Leone, and Nigeria. The World Health Body says extensive contact tracing and monitoring implemented with the support from the U.S. Center for Disease Control and Prevention has kept the number of additional cases small in Nigeria. Elsewhere, the outbreak is expected to continue for some time. The medical charity Doctors Without Borders estimates that the outbreak of Ebola in West Africa would take at least 6 months to bring under control. The WHO's operational response plan extends over the next several months. Staff at the outbreak sites see evidence that the numbers of reported cases and deaths vastly underestimates the magnitude of the outbreak.
There's fear, it's normal, but that fear needs to be translated and be mobilized. Fear will keep us alert, but then we need to mobilize, and then we need to create more cooperation. Because we never faced that before, unless everybody put their effort together, it will not happen. We've said it over and over and over again, and I think it's happening. We're more or less on the same page. WHO needs to take a leadership and bring some strong element into the field that are operational.
Contact with the nurse.
The experimental drug nanosilver, which was announced by the Minister of Health, Professor W.H.O, to be used for the Ebola patients, is yet to be received by the Lagos State Ministry of Health.
On the nanosilver drug, yes, we heard on you that the thing is on the way to Lagos. We have not received delivery as of now, but let me say, I go for the evening briefing at the EOC, Emergency Operations Center. When I go there, first I will get the full details. As of now, I am not aware of the drug here. Perhaps it's there, it's come. But again, we in Lagos say we are also exploring such possibilities because we sent our pharmacists to inquire properly from the two manufacturing companies how best to get them.
Meanwhile, officials in Liberia face a difficult choice of deciding which handful of Ebola patients will receive an experimental drug that could be life-saving. ZMapp, the untested Ebola drug, arrived in the West African country late on Wednesday. The government had earlier said 2 doctors will receive the treatment, and Information Minister Louis Brown revealed that the 3rd person will probably be another healthcare worker. These are the last known doses of ZMapp left. Kenya Airways has rejected pressure to suspend its flights to the Ebola-hit states of West Africa. This is coming after the WHO, which declared a global health emergency last week, recently said the risk of transmission of Ebola during air travel remained low, as the disease is not airborne. This has been eliciting mixed reactions from the media in Kenya. As we wrap this up, a woman is being tested for the Ebola virus in Scotland after falling ill at an immigration removal center. Health authorities have confirmed they are investigating a possible case of the deadly virus, but have said it so far appears highly unlikely the test would turn out to be positive. The woman is believed to have arrived from Sierra Leone, one of the countries most affected by the epidemic in West Africa. Yomi Otaigbe reporting for Channels Television News.